So today I'm going to demonstrate your competency for spiking and priming secondary and primary tubing. So you're going to start your competency by verifying your physician order. So you have your physician order and you have your MAR, and we're going to verify that we got the right patient, Mark Kennedy, date of birth 10/15/44, MRM numbers match up. We have sodium chloride 500 milliliters at 125 milliliters per hour. And we're giving Vanco 750 IV piggyback twice a day over an hour. So my MAR and my physician's order match up. I'm going to check for allergies. He has no known allergies. I'm going to gather my necessary equipment. So I got my primary tubing, my secondary tubing, got my pump. Patient already has an IV in. And then I'm going to get ready to pull my medications from my med cart and do my first MAR check. So I'm going to grab out of my med cart my normal saline. It is 0.9% and it is from Mark Kennedy. I got the right patient. Drug, normal saline. Dose is going to be at 125 milliliters per hour. It's going to be a primary IV and it is the right time, and I will document later. So if you want, you can go ahead and gather your secondary at this time, or you can break it out and do it later. So I'm going to go ahead and get my secondary. I have Mark Kennedy. I'm giving Vanco 750 milligrams IV piggyback over an hour. So right patient, drug, dose, route is IV piggyback. Time is now, and I'll document later. Okay, so now that I've compared my MAR to my med, I'm going to go ahead and do my second check to make sure that it is correct. So I got Mark Kennedy, 0.9% normal saline. Is that going to go at 125 milliliters per hour? So I got the right patient. Drug, dose, route is IV primary, time, and date. Okay, same thing for my secondary. Mark Kennedy, right drug, patient, Vanco 750 IV piggyback over 1 hour. It's the right time, and I will document later. So now I'm going to go in my patient's room. I'm going to introduce myself. Hi, Mark. My name is Liz. I'm going to be your nurse today. Can I have your name and date of birth? 2 patient identifiers. Make sure I wash my hands. If family is present, I'm going to explain the procedure to them as well. And then provide privacy. Patient understands the procedure, so no questions. I'll do my third check. So I have Mr. Mark Kennedy. Date of birth is correct. Right patient. Drug, I got the normal saline. It's going to go at 125 milliliters per hour as a primary IV. Patient, drug, dose, route. Time is correct, and I'll document later. Same thing for my secondary. I have Mr. Mark Kennedy. Date of birth is correct. Vancomycin 750 milligrams. It's going to be IV piggyback over 1 hour. Got the correct time, and I will document later. I'll check again the patient. Do you have any allergies? He says no. Okay. So I'm going to go ahead and remove your IV bag. If it's in a plastic, remove it. Then I'm going to go ahead and remove my primary tubing. Now the first thing I'm going to do when I remove this is make sure I clamp it. Found my roller clamp. So I'm going to go ahead and roll it down, which is clamped. You would remove your plastic cap, making sure not to contaminate this. Okay. Take this off my normal saline. We're going to screw this in. Okay. And I'm going to go ahead and hang this up. I'm going to squeeze my drip chamber about half full. I'll untangle my tubing here. Here we go. I'm going to open up my clamp and let it run through to get all my air bubbles out. And I'm going to go ahead and clamp it. And now I'm going to use my electronic pump to go ahead and set my rate. So the first thing you're going to do is you're going to hit the on button, which is going to turn your pump on. See if I can't get you a little closer here to this pump. Okay, so my pump turns on. It's going to say, is it a new patient? Click yes. Yes, we're on the med-surg floor, and go ahead and confirm. So 2 yeses and a confirm. Now you have to come over here and select which channel you're going to use. I'm using channel A. And then it's going to say, do we want drugs or IV fluids? I want fluids. You will find your normal saline on here. It says, did you mean to select normal saline? Yes. What rate? 125 milliliters. There's 500 in my bag. I'll go ahead and open my door. Blue hat goes on top. Blue box slides in. And then we get it closed. And we're going to, we're all ready to go. So I'm going to hang this up here. I'm going to go ahead and wash my hands and put clean gloves on. Go over to my patient. Take my cap off. Scrub the hub for 15 seconds. And then we're going to connect our IV. Make sure that this is unclamped. We can go ahead and hit start. Now the yellow light means it's checking to make sure there's no obstructions anywhere. If it finds an obstruction, it's going to beep at you and say whether it's on the IV side or the patient side. So it says occlusion, patient side. I forgot to unclamp, so we'll unclamp that and go ahead and hit restart. Green is good, so we're good to go for our primary. Okay, so then this part of the competency, we're moving to our secondary. I did my first and second MARD check on this when I pulled it out of the cart with my primary bag. I'm going to double check the patient's name and date of birth. Mr. Kennedy, can you give me your name and date of birth? Okay. And then since I'm in the room, I'm going to do my third check. I got Mark Kennedy, Vanco 750, IV piggyback, give over 1 hour. It's the right time, and I'll document later. Remove my secondary tubing from my bag. Okay. Remove this. I need that. I'll go ahead and put this up here for right now. Okay. Make sure I clamp it. Okay. If this is in a plastic wrap, I'd remove this. Okay. Take off my plastic cap on my spike, making sure I do not contaminate my spike. And then this is going to get screwed into here. Okay. And then, I'll go ahead and put this up here. I'm going to drop my primary. I'm going to get my alcohol swab, and I'm going to scrub the hub up here for 15 seconds. You're above the pump. Okay? We'll go ahead and connect this. Now I'm going to drop this below and open up my clamp, which is going to back prime my tubing. I'm going to get it about half full. Then I can raise this back up here. Okay. I already lowered this. Now I need to set my tubing for my secondary. So you're going to start by hitting the channel. So hit channel, and it's going to bring up a screen, and down here it's going to ask if you want secondary. Yes. Now you have to look for your medication. I'm giving Vanco. And I'm going to pick milligrams per milliliters because I need to program it. Yes, I meant to hit that. It is 750 and 250 milliliters. Click next. And it's going to say duration on here. My duration is 1 hour. So I have to put in 100 to get 1 hour in the machine. Then I'm going to click start. And I'm going to watch to make sure my secondary starts dripping. Don't leave the room unless you're sure your secondary has started. Okay. So I have set that. I'm going to watch my patient for any signs of symptoms of a reaction. I'm going to then make sure the bed's in the lowest position. He's got his call light. I'm going to go document the type of IV solution and rate, insertion site, how it looks, site assessment, how the patient tolerated, and any patient teaching. Okay, there you go.